We'll take question number 9. A midwife was plotting a partogram for a patient in labor. Ideally, how much cervical dilation she must start plotting the graph? At what cervical dilatation, ideally, the partogram is started? When should we start plotting a partogram? Now, this question was fairly simple a few years back, and we all answered 4 centimeters even without batting our eyelids. So, even without thinking once, because that is actually the answer which I want you people to write for this question. Now, the problem is that there was so much discussion about this for the last 4-5 years in journals and in the WHO forum and the American College of Gynecologists recommendations. There is so much discussion about this that this made us think twice before we came to this conclusion of 4 centimeters. Those who written 4 centimeters, I hope you get the right answer. But the problem is that all exams, whether it is the the complete exam together for these or the NEET exam, they are not giving us the answers. If they start giving us the answers, life would be much simpler. You'll have to read more things, but at least you know what is the answers expected. What is the answer to this particular question, which was difficult, but that's the answer expected. Next time, at least you know that I can answer this and get the right marks. But that is not happening in exams, and we are starting I'm starting a chain of letters. I hope that you people also support this cause, that you must know the answers of all the exams which you are attempting. So let's come to this. The answer is 4 centimeters. Now, there's a lot of doubt about this. Why? Because like I've taught you 4 centimeters. See, I've started plotting the partogram at 4 centimeters onwards. But let's see, what do the Americans say? Now, Consensus Committee of American College of Obstetrician Gynecologists and Society for Maternal Fetal Medicine has redefined active labor to begin at 6 centimeters. So when the active labor starts at 6 centimeters, then why should you plot before that? Okay, so that's what the Americans say. Now, this is what the WHO says, 2018, that cervical effacement and more rapid cervical dilatation from 5 centimeters until full dilatation for first and subsequent labors. So for them, active labor is this one. However, the duration of active first stage from 5 centimeters until full cervical dilatation. See, again, active first stage. So for them, active labor is 5 centimeters. That is WHO. I'll read more about what WHO says. We'll read from here. Plotting should commence from a cervical dilatation of 5 centimeters, which signifies the onset of active first stage of labor. Now, these are all 2018 WHO recommendations. So the problem is, the Americans say 6 centimeters, the WHO people say 5 centimeters, but for all practical purposes, please try and understand, if a patient is 5 to 6 centimeters, there's hardly any labor left. And at 5-6 centimeters, if you've not seen active labor, then it's actually very late. At 5-6 centimeters, we know that the patient will deliver in a reasonable time, and if she does not deliver in that reasonable time, we'll go ahead and do a cesarean section. So I think it's pretty late to start a partogram, and that's why I answered what I answered. I have answered that it is 4 centimeters because that is what the good old teachers O'Driscoll and Dr. Friedman, these are the people who actually devised the partograph, and when they devised the partograph, they thought of 3 to 4 centimeters, and that's what I think we'll stick to for the time being, because traditional teaching is what is important. Now, to get you more convincing answer that it is 4 centimeters, it is what was taught. This is what doctors taught, that the labor starts going to a much more active phase of contractions and regular dilatation and regular descent after 3 to 4 centimeters. 3 centimeters, sometimes we are not using that anymore because a patient might still be in latent phase of labor. So 4 centimeters is a very practical definition. Now, I called up all the institutes which I can't name here in this forum. I spoke to people who are at my level, and I spoke to them. They are very senior people. Then I rang up Great Britain also. I rang up my friends who are consultants there and said, right now you can see my midwives here, they're sitting and plotting the graphs at 4 centimeters. So I convinced myself once more, just for the sake of answering you with conviction, that yes, the answer is indeed 4 centimeters. Active stage of labor, if they ask you, well, I will have to ask you to mark 6 centimeters if they ask you that, because Williams Obstetrics is saying that, and that is the book which is important, and that is the book which is considered as a Bible for references, and I cannot disregard that. So plotting, go with 4 centimeters, and active stage of labor, if they ask you, 6 centimeters. I think the answer should be same, 4 for active and 4 for plotting, but simply because 4 centimeters watch is practically used across the country even now. The recommendation of 6 centimeters, but it has not been put into practice. So I did a lot of research to come to this conclusion that we'll stay at 4 centimeters. Okay, all right.